Hey, so welcome to Accessibility Foundations. Um, so in this video, we are going to outline how our understanding of disability is shifting. We're going to differentiate between different types of disabilities. We are going to explore the prevalence of disability in Nova Scotia, and we are going to define accessibility and ableism. Our understanding of disability is shifting. So for most of the 20th century, the medical model was used as the basis for conversations and concepts about disability. Disability was viewed as a result of a physical condition or illness, and persons with disabilities were treated as patients in care. This view of disability is still held by many, but disability advocates are pushing for a social model of disability that is rooted in human rights. And on the side, there is a photo of a man with a prosthetic leg seated in a chair. And the photo is from the chest down, indicating and symbolizing how the medical model sees a person as their disability and not as a full person. So our understanding of disability is shifting. So the social model shifts away from a medicalized understanding of disability and acknowledges that our environments present barriers. As a result, disability is considered a social and cultural issue where the environment creates the barriers. Often our environments, policies, and practices are not developed considering people with disabilities, and access and inclusion can be created by removing barriers. And this is important as it centers the voices and experiences of persons with disabilities at the forefront, and instead of patients, they are treated as the experts in their own experiences. And so on the slide, there is a photo of the same man that we saw in the last slide, seated on a bench, but this time with a coffee beside him and a laptop in his lap. This is to understand the social model, to display the social model that we see the full person and not just a person's disability. Okay, so introduction to disability. So to broaden our understanding of disability, it is important to have a sense about what this looks like in Nova Scotia. So did you know that based on the 2022 Canadian Survey of Disabilities, Nova Scotians reported the highest rate of disability in the country, with 37.9% of our population living with a disability, while the national average is now 27%. So this number raises to 49.2 for Nova Scotians aged 65 and older. And according to the Nova Scotia Quality of Life Survey conducted by Engage Nova Scotia in 2019, those with a disability consistently rated a lower level of well-being in all areas measured. So, types of disabilities. So, disabilities can be physical, mental, intellectual, and sensory. So, these categories listed here are based on the definition of disability used in the Nova Scotia Accessibility Act, and they may help us understand a spectrum and diversity of disabilities. So, at the same time, we also need to acknowledge that each category is not rigid and can look different for each individual. And so some disabilities may be experienced by people in varying ways, or they may even fit into multiple disability types at the same time. It's also important to note that it is not appropriate to ask someone the nature of their disability. And so visible disabilities. So to understand disability, we need to recognize that there's a diversity of experiences based on a number of intersecting factors. And one of those factors can be if a disability is visible to the wider society. So most people are familiar with visible disabilities since they affect the way individuals look or behave, such as someone who uses a wheelchair or a service dog to get around. And on the slide, there are 3 photos depicting examples of visible disabilities. So the first image is of a woman in a wheelchair, used as a mobility device. The second image is of a woman with Down syndrome doing yoga. And then the third picture is of a individual using a white cane for vision loss to detect the entrance to a building. So invisible disabilities. These can be overlooked and misunderstood as they may not immediately come to mind when you think of disability, and they are not physically visible. So sometimes misinformation regarding these disabilities can lead to ignorance and stigma about the experiences of people living with invisible disabilities. So it's important to keep this in mind when we consider what equitable access looks like in our environments. So some examples of invisible disabilities include mental health conditions, learning disabilities, diabetes, brain injuries, gastrointestinal conditions, chronic pain, and more. So on the slide, there are three photos depicting examples of people with disabilities. So we have first image is a man with diabetes testing his blood glucose levels. The second image shows a person wearing an ID badge who has no visible disability. However, they do have a learning disability. And the third image shows a woman sat at a table working on her laptop. And she does not have a visible disability. However, she experiences debilitating pain from endometriosis. And so episodic disabilities are dynamic in nature and change between periods of wellness and disability. So episodic disabilities are really unpredictable, lifelong, and may vary in severity um, and duration at different times during an individual's life. It is important to note that people can live with both permanent and episodic disabilities, which may be visible or invisible. So on the slide, there are three photos depicting examples of people with disabilities, with episodic disabilities. So the first one is of a breast cancer survivor holding a pink ribbon. And the second image shows a man with arthritis who is reading a piece of mail. And the third image is of a woman who lives with bipolar disorder. However, her disability is invisible and can change from day to day. And it's important to acknowledge that many people experience more than one type of disability at the same time, and it may fluctuate between being visible and invisible, and episodic or reoccurring in nature. And so this brings us to person first language. So to expand on our understanding of disability language, the key to remember is that people with disabilities identify in many ways. And some people identify as a person first, and their disability is only a part of who they are. This is person first language. So on the slide, there's an image of a stick person holding a puzzle piece, which represents their disability. In this case, this image is of a person with autism. And so we typically use person first language. We default to saying a person with disabilities. However, it is always important to listen to the language that people use to describe themselves and mirror that language back to them whenever possible. Okay, so identity first language. So as people with disabilities identify in many ways, uh, some identify with their disability understanding it to be a significant part of who they are as a person. This is called identity first language. So you may notice some disabled people making the comparison to other identities, saying you would not refer to someone as a person with blackness or a person with whiteness. Rather, you would say a black person or a white person. And yeah, so on the slide, there's an image of a stick person surrounded by a piece of a puzzle. So they're kind of like inside the puzzle piece. And the puzzle piece represents their disability. And in this case, this image is of an autistic person. So what is accessibility? So accessibility ensures people with disabilities are not excluded from experiences, benefits, opportunities, and choices in life. So an example of accessibility would be including alternative text when using images, so that screen reader users do not miss necessary information, or ensuring that events include ASL interpretation and captioning. Okay, so and on the slide, there is an image of three people seated and sharing drinks in one corner of a bright space, including one who uses a manual chair and another who has a service dog on a leash. And the person who has a service dog is also signing in ASL. Perfect. Okay, thank you very much. And the image on the screen is a hand holding a lens, looking at a blurred landscape with mountains and a lake.